Today's program looks at CPR and its value in saving lives. This is another project that the Rotary Club of Gros has invested in, recognizing that there is a lack of trained people to respond to emergency situations, especially those involving children. Julie Lambert, an emergency first response instructor and a former UK operating theatre nurse, was commissioned to work with teachers from schools in the north of the island to make them CPR ready. If a cardiac arrest happened to your loved one or a close friend, would you know how to perform life-saving CPR, which can double a victim's chance of survival? Surprisingly, many people don't. Do you even know what CPR is? Cardiopulmonary resuscitation, or CPR, is an emergency procedure performed on people suffering cardiac arrest. The purpose of CPR is to provide a continuous flow of oxygen to the lungs and brain until the person regains consciousness. The human brain can only survive an average of 5 minutes without oxygen, after which time permanent damage is done. By performing CPR on a victim, the rescuer is increasing the chances for a full recovery. However, it is important to remember that CPR alone is rarely enough for a person to survive. The true purpose of CPR is to keep the heart pumping and the oxygen flowing until emergency care arrives. CPR is often used when no other assistance methods, such as defibrillators, are available, but it can also be done by medical professionals on patients who have just recently lost their pulse. It is believed that the sooner CPR can be started on a victim, the better their chances of survival. CPR is performed by alternating chest compressions and mouth-to-mouth breathing. The standard is 30 chest compressions followed by 2 deep rescue breaths and back to chest compressions immediately. CPR is performed on people who have drowned, suffered a heart attack, or experienced a drug overdose or poisoning. CPR can also be performed in choking victims when all else has failed. CPR can be performed on children of any age, including babies, and in animals. On animals, CPR is performed by pressing down on the left side, on the upper part of the rib cage, and blowing air into the nose, not the mouth. On infants, the procedure is the same as in adults, although the pressure exerted in the chest should be much less. In addition to CPR, Julie coordinated an emergency first response care for children course for the teachers. By becoming an emergency responder and learning how to handle situations involving injured or sick children, you are empowered to make a difference. You can't control all the variables, but you can offer assistance that may improve a child's chance of a positive recovery. If you're willing to jump in and help, you become an important link between the problem's onset and the arrival of professional medical personnel. Again, you can't guarantee the final outcome, but you will know that you did all that could be done. The Care for Children course is an innovative CPR and first aid training course that teaches you to provide emergency care for injured or ill infants and children. This course includes both CPR and first aid skills. The primary care portion of the course prepares you to render aid to an infant or child with life-threatening emergencies such as choking or cardiac arrest. Secondary care focuses on developing secondary patient care skills and building your confidence to give first aid to an infant or child in need. Upon successfully completing this course, you can receive a certification card which is valid for 2 years. Think about becoming an emergency responder or signing up for a first aid course. This program was brought to you by the Rotary Club of Gros.